Test. Test, test, can you hear me? Good to go? All right, good evening. Luis WILMOT, Assistant Director of Public Health for Corpus Christi, Nueces County. We'd like to welcome you tonight. We're going to give you a quick update on the COVID situation in our area. And we'd like to also give you guys some insight of what to expect during the holidays regarding COVID and our vaccinations efforts. So our first slide here, just to give you a quick update on our daily case count. This is actually for the month. We're up to 1,070 cases for the month of December. That already has surpassed November. November was the low of that, the downside of that peak we had for the previous summer. So we kind of up. At this point, we're expecting to probably reach maybe 1,400 to 1,600. That's back to where we had the October numbers. Hopefully it does not go any faster, but in light of what we're hearing through Omicron, we have had to react and make sure that you guys are taken care of. Next slide, please. This is a weekly breakdown. We initially had a little scare in the week of November 29th, and we thought that we were starting to see a little uptick in cases. That came down back down the next week, and this week we're up to 314 so far. So, although it doesn't look very concerning on this particular graph, we do see indications that the cases counts are going to be climbing soon. Next slide, please. Our current deaths for the month of December is 14. That's relatively low, however, still 14 too many. We'll continue to monitor those and give you those updated numbers as we take along with hospitalizations and ICUs. Next slide. A big concern for us is vaccine breakthroughs, and once I get to talking about the Omicron and the updates on Omicron, you'll see why. This particular slide here shows that we have currently 1,875 vaccine breakthrough cases. Knowing that we know a little bit about Omicron and its potential to escape immunity, we're going to convert this for you guys in a graph so you can start seeing if the vaccine breakthrough cases increase. Regardless, we are seeing that the vaccine is still effective to keep people out of the hospital and to lessen the disease process from the current strain that's in our area. Next slide. So Omicron. This variant has swept across the nation. It now accounts for 73% of all new cases in the U.S. The variant seems to be highly transmissible. At the end of November, the Delta variant was accounted for 99% of the cases. So within 22 days, Omicron has taken over as the dominant strain in the United States. So you see why we're being very cautious. We're being very we're planning ahead because we see what's coming. We see what's out there in the U.S. and in Texas. Although I don't have a piece of paper that says we have Omicron in the Nueces County, we have tests that are pending for genome sequencing, and it's just a matter of time. So the computer modeling suggests that the variant may also escape immunity, whether it be vaccination immunity or natural immunity from getting infected in the past. So it's showing that if you were previously infected with COVID, you had an immunity, and that immunity is not enough to keep you from getting it the second time around. So that natural immunity is not enough as well. So again, we're going to continue pushing vaccinations to thwart this disease process. The first death from Omicron variant occurred Monday in Texas. There was a gentleman in his 50s. He was unvaccinated, and he had previously caught COVID-19. So again, he thought he had that natural immunity, and he succumbed to the virus the second time around. COVID-19 cases are rising across the U.S., likely because of the Omicron variant. As you see the last bullet point here, you say Omicron is on its way. Ladies and gentlemen, I believe that Omicron is already here. Again, I don't have a piece of paper that says that, but the indications are showing that it's already here. So now is the time to prepare. So let's not panic. Let's go back to our basics, back to our fundamentals. What helped us out from the get-go? We started wearing masks. We started washing our hands. We started social distancing. We started staying away from congregate settings. I'm repeating these things because we are about to go into the holidays where people congregate, where people are going to get together, okay? So, number one, if you're not vaccinated but have been thinking about it, now is the time to go get vaccinated. If you are fully vaccinated with Moderna, Pfizer, or J&J, now is the time to go get boosted. The Moderna booster is recommended 6 months after your second vaccination if you're 18 and older. The Pfizer booster is for 6 months after your second vaccinations if you're 16 years old and older. For J&J, the booster is recommended 2 months after your first dose if you're 18 and older. Pfizer, again, has been approved for children ages 5 to 11. We encourage you to get your children vaccinated. We've already done some great work with the CCISD here. We were able to vaccinate over 587 kids in the local elementary schools, and we'll be doing our second doses soon at the beginning of the new year when they're due. So again, use your public health measures in combination with getting vaccinated. Again, wear your mask in congregate settings. Keep your home and workplace well ventilated. Keep the windows open if you can. If you can be outside, it's probably better to congregate outside. Stay home if you're sick. That's probably the best Christmas present you can give your folks, the people your loved ones that you're going to be congregating with. If you're sick, please stay home. Do not go to the party. Get yourself tested, and we'll be talking about our testing resources here later. Wash your hands often, especially our children. Let's watch our kids. They're so quick to put their hands in their mouth, touch their face, etc. So before they're going to have some snacks, holiday snacks or foods, please make sure they're washing their hands. Next slide. So our current vaccinations that we've administered, your health district has administered over 190,000 vaccinations. That's a tremendous accomplishment, and I applaud my staff for this tremendous effort that they've done. Trust me when I tell you that their heart is in the right place, and they're concerned about your welfare, and they'll continue to provide vaccinations to this community. Over 139,000 of these vaccinations were Moderna, 9,000 were J&J, Pfizer over 39,000, and our kids are just beginning, so about 3,100 so far. Next slide. Our boosters. The health district has administered over 20,000 boosters. For Nueces County as a whole, we have boosted roughly 30,000. So your health district has done the majority of those. We're about 30% of the fully vaccinated folks have been boosted. So we have a long way to go. These folks that have already been vaccinated, we've only done about 30% of them. So we're looking forward to getting their boosters in their arms. Our current vaccination rates for Nueces County as a whole, we're at 53.7%. That means half of us, roughly half, are unprotected at this time. Our eligible population of 5 years old and above are 57.3% fully vaccinated. Our 12-year-olds and above are 64.2% fully vaccinated. And our 16-year-olds, 68.6% vaccinated. And again, we look to our elders, 65 and older, they're 80% fully vaccinated, so we need to really model our elders, and they're showing us the way forward, so if we could listen to them. For the month of December, at the bottom, we've already reached over 11,000 vaccinations for this month. Pending the end of the last few weeks of this month, we tend to surpass the previous month, roughly about 20,000. So where can you get vaccinated? So we still have our sites available. La Palmera Mall, Greenwood Senior Center, the Robstown Outlets, the former Nike store, the Physicians West Building in front of Old Memorial Hospital, the Nueces County Courthouse, and the City Hall. All sites will be closed on Christmas Day. The Physicians West also closing on Christmas Day. Our courthouse, they will be closed on the December 23rd through the 26th and December 31st through January 2nd. City Hall will be closed on December 24th through January 2nd. We do have our off-sites available as well. Our QRS Legacy Event Center, we'll do that on Monday. We have adjusted the times because it gets darker sooner and it's a little unsafe out there. Can't work in the dark. So we are working from 10 to 5 at these locations. Tuesday and Thursday will be at the Goodwill Clearance Store on Ayers. and Falas parking lot on Wednesday from 10 to 5 as well. Again, we're working with our ISDs to get as many kids vaccinated as they wish. COVID vaccination testing. We have decided to continue our testing efforts during the holiday week that's coming. On Monday, Tuesday, and Wednesday of next week, we will provide COVID testing from 9 to 2 in the Old Memorial Hospital parking lot. You don't have to pre-register. You come in, we'll take care of you, get you swabbed, and we'll make sure that we get the result to you as soon as possible. After this holiday week, we will resume our Monday and Thursday vaccinations from 9 to 2 at that same site. There are other local resources to get tested as well. So those are probably listed on our city website. Treatment. So we have our rapid infusion centers. The county currently does not have one at this time since our cases went down. Our state assets is still available. They're available at this phone number here, 1-800-742-5990, or at www.stateoftexasinfusionhotline.com. I'll tell you, a physician's referral is still required. So for any providers that are listening, if you need to know where and how to send in a referral, you can go to that website. At the bottom of this slide, there's also another link that you can type in, and you can put in your referral directly so that the state gets your referral directly, and they'll reach out to the patient to get them treated. Spawn Quick Care is also available at this phone number, 361-902-6992. There is a wonderful local nurse practitioner, Miss Angela Stith. She's done a tremendous help to the community by offering rapid infusions with monoclonal therapy. Her number is available, 361-461-0166. And also, any Access Total Care urgent care facility also has the ability to give monoclonal infusions. You have to reach out to any location that you want to go to. So, holiday tips, what can we do to keep ourselves safe? Protect those not yet eligible for vaccination, such as our children. Remember, our children under the age of 5 are not eligible for vaccinations. We often run to the store with them. We go Christmas shopping with them. It's important that these children are being masked, that you're watching what they're touching, that you're watching what they're eating. I know parents are already doing that, but we got to give that a little more heightness or alert when it comes to those things that our kids are doing. Protect them. Wear well-fitting masks over your nose and mouth if you're in the public indoor settings or if you're not fully vaccinated. Even those that are fully vaccinated should wear a mask in public indoor settings in communities with substantial to high risks of transmission. You want to avoid crowded and poorly ventilated areas. Again, if you are sick or having symptoms, do not host or do not attend a gathering. Get yourself tested. Testing can give you information about your your risk of spreading COVID-19. If you are considering traveling for the holiday or an event, please visit your CDC travel page to help you decide what is best for you and your family. CDC still recommends delaying travel until you are fully vaccinated. And if you're leaving internationally, there are other requirements such as testing before and after coming back. So make sure you look at the CDC guidelines when it comes to testing. And that concludes my brief. We're going to be followed by Ms. Gabby as a translation and our county judge, Barbara Canales.
En lo que va del mes de diciembre son 1,070 casos positivos al coronavirus. Este mes se han reportado 14 fallecimientos. El reporte de casos extraordinarios, o sea, personas que han enfermado a pesar de contar con la vacuna, es de 1,875. La variante Omicron continúa siendo una variante de preocupación. La variante Omicron se ha extendido por todo el país. Ahora representa el 73% de todos los casos nuevos en los Estados Unidos. La variante parece ser altamente transmisible. A finales de noviembre, la variante Delta representaba el 99.5% de todos los casos. En 22 días, Omicron se ha convertido en la cepa dominante. Los modelos sugieren que la variante también puede escapar la inmunidad. La primera muerte por la variante Omicron ocurrió el lunes en Texas. El hombre tenía 50 años, no estaba vacunado y había contraído previamente COVID-19. Los casos de COVID están aumentando en los Estados Unidos probablemente debido a la variante Omicron. El Distrito de Salud ha administrado un total de 190,622 vacunas, la mayoría de la farmacéutica Moderna. En cuanto a vacunas de refuerzo, se han administrado 20,112. El horario de las clínicas de vacunación para estos días feriados: las clínicas son el Centro Comercial La Palmera, el Centro para Adultos Mayores de Greenwood, el Outlet Mall en Robestown, en la ex tienda Nike, y Physicians West, en el 2601 del Hospital Boulevard. Estas clínicas van a estar cerradas el día 25, mientras que la Casa del Corte del Condado de Nueces va a estar cerrado del 23 al 26 de diciembre y el 31 de diciembre al 1 de enero. El Ayuntamiento estará cerrado del 24 de diciembre al 1 de enero. En cuanto a las pruebas COVID, la próxima semana van a haber pruebas el lunes, martes y miércoles en el antiguo Hospital Memorial de 9 de la mañana a 2 de la tarde. Después de esta semana, el horario de pruebas reanudará a su horario habitual. En cuanto a los tratamientos de anticuerpos monoclonales, existen recursos en el área de Corpus Christi, así como los hospitales Spawn y Access Total Care, y así como en todo el estado. Para más información puede llamar al 1-800-742-5990. Recuerda que se requiere de una referencia médica para poder recibir este tratamiento. Algunos consejos para estos días de fiesta: proteja a aquellos que aún no son elegibles para la vacunación, vacunándose usted mismo y a otras personas elegibles. Use cubrebocas, especialmente si no está completamente vacunados. Evite los espacios concurridos y con poca ventilación. Si está enfermo o tiene síntomas, no organice ni asista a una reunión. Quédese en su casa y hágase una prueba. Y si tiene planeado salir de vacaciones o asistir a un evento, visite la página de viajes de los CDC para ayudarlo a decidir qué es lo mejor para usted y para su familia.
Good afternoon, everybody, and Merry Christmas. Barbara Canales, Nueces County Judge. Well, this, I hope, is our last COVID briefing for 2021. But I want you to stay tuned every day to the best information that you like to receive, whether that's through the radio, through the television, or through our websites, because things are changing rapidly. And the city is scheduled to be off next week so that the hardworking people who put these COVID briefings together after so many briefings throughout the year and all the hours they spend, that they can spend time with their families. However, that does not mean that we are not going to be vigilant in keeping our residents, and of course you, the media, of any breaking news via all the social media platforms we have, both the City of Corpus Christi, the county, and also the health district. So, again, if we have to have a press conference, we will, but I do believe that we will see you in our new year. Now, as you know, and was so perfectly well articulated by WILMOT, Assistant Health Director, we've been dealing with the Omicron variant of the coronavirus here in our country, and it arrived just after Thanksgiving. Isn't it amazing? Just such a short time ago has caused such a big difference. And as was noted, the thing that really makes me look up is the Omicron variant is believed to account for more than 75% of all COVID infections. So, again, just as you heard earlier, I'm going to try to give you more of a summary. It's highly contagious. It's easier to catch. If you do get infected with it, however, it appears from the early data, and I want to emphasize that word early data, that you are less likely to need to go to the hospital. That's the good part. However, there are always people, unfortunately, that do get hospitalized, and they also will fall into that category of perhaps having higher risk if they have comorbidities or diseases that they're afflicted with. So, what's the summary? Omicron is a much easier to catch strain, but it's not as likely to send you to the hospital at this point. But those who do get sick enough to need hospitalization, they have about the same risk, more or less, the same severity of illness as those who were infected with the original coronavirus and the Delta variant. So what does that tell us? You don't want to catch this, because if you're one of those people that has the comorbidities, that winds up going to the hospital, it's about the same. Omicron doesn't treat you any better than Delta. So I need you to know what we're doing to make certain that we're all going to be safe this holiday season. I'm doing this not only as your Nueces County Judge, but I'm doing this in my capacity as our emergency management official. And again, I go back to the beginning of 20, and 21, we always said in our office, we would follow the science, we would be driven by data. In the first waves, our case counts and our hospitalization rates tracked pretty well. There was such a correlation that we could actually make predictions. And cases predicted hospitalizations, and hospitalizations predicted deaths. And thanks to that data, we were able to really always pivot, making certain that our hospitals had the right staff, that our hospitals had the right medications and treatment were available inside your city and outside your city limits as well in the rural communities. However, that was then. This is now. We just simply don't know if that type of correlation will hold this time. So Omicron is marked by being more transmissible and, as I said, but producing less severe illness. But case counts are based on tests. And some people, we don't know how many, of course, during this holiday season, they're going to get exposed, they could be infected and become ill. And many will experience mild symptoms. And they may say to themselves, I don't need to get a COVID test. So there may be more, but if people don't get tests, we can't see it. So I like what WILMOT told you. If you feel sick, don't go out and go get tested. Because we need to make sure we understand who you have been around so that we can do that so important process of contact tracing. And again, I just don't know, and they don't know in public health just yet, how all of this is going to balance out. So I'm monitoring case counts every day. I'm not going to move this holiday season without starting with my, texts that tell us in public health and in emergency management what's going on. And something changed today. And so we changed too. So the number I'm going to focus on always is COVID hospitalizations, okay? That's the one that gets me nervous. And I'm also going to be looking at that capacity. As hospitalizations and our ER comes up, I'm going to be making sure that those capacity numbers stay right where they need to be. Why? Well, because even if it's mild symptoms, we don't want our emergency rooms packed with people, because that takes away from the seriousness of when you need those emergency rooms for other illnesses. And again, we don't know who is going to have to go to the hospital, but we do know that if you're there with COVID, you've got the same severity of illness as previous waves according to that data that we're following. Now, I'm hopeful, and I believe at this moment that number is low. But again, increased transmission, less severe symptoms, will they balance each other out? We're going to be monitoring. That's my message today. It's not just about watching. It's really about the surveillance that leads to the pivoting on what we do to protect this community. And so that's what I wanted to do. I want to make sure that we're advising the residents of what you can do to protect yourself, your family, and your community, particularly during this beautiful season of the year when we're all gathering together. And I'm going to echo again about the vaccinations. If you have friends coming in, family coming in, and they didn't get a chance to get boosted in their communities, take them to La Palmera Mall. We're closed at Christmas, but we are going to absolutely get them at the time that they stay that next day. We'll be open on the 26th, or we're probably open on Christmas Eve. I'm getting that nod. We're open on Christmas Eve. What a great gift you can give to your family. It isn't that easy. Just so you know, I heard from somebody in Austin just a couple of days ago that getting a booster, you have to create an appointment. There's no appointment needed here. Just go on by. It's still the best thing you can do because they prevent infection, and when infection occurs, they make the ability to recover from those symptoms milder. They can shorten the duration of illness, and they reduce the need to go to the hospital, and that means they can prevent death. And so the other thing you can do is monitor your symptoms. And again, when in doubt, please go get that COVID test. Now, you've already heard, but it's worth mentioning again because I'm going to add something to it. This morning, we discussed amongst ourselves in public health how we could make a change because we saw change. And what we've made the decision to do is your county testing agents, your COVID testing agents is what we like to call them. They are going to be handling testing Monday, Tuesday, and Wednesday next week from 9 a.m. to 2 p.m. at Memorial Hospital. If we see the lines too long, Lewis, if we see too much of a demand, we will pivot, find the personnel, and open that up further. But for now, we're going to start from 9 a.m. to 2 p.m. And again, we think that if we also see that cases are rising and we don't feel that those rapid infusion centers at the state level are good enough, we're going to make that decision to open them up locally. But with Ms. Stith's assistance and going to folks' places of home or business, we are making a difference each and every day with those monoclonal antibody treatments. So remember, if you get tested and things get worse, please act early. Call those numbers that we've identified and get treatment. And again, these treatments have really proven to be excellent. They're monoclonal antibody treatments like Regeneron. And also, if you get them early enough, there is a window. They can help you so that you don't find yourself in the hospital. Again, I want to reiterate the importance of these phone numbers that you need because the state of Texas does operate this mobile infusion clinic, and it does require a doctor's referral. So if you have questions, you can call the Public Health District at 361-826-7200, and also that big state of Texas phone bank that we talked about. I definitely want you to know that there's qualifications for the monoclonal infusion therapy, and they're all on our website. But just to be a quick bullet points, you got to be over 12, you've got to be at least 88 pounds, and you have to have be within the 10 days of the symptoms. So that is the monoclonal infusion therapy. And there's also remdesivir that we use in the hospitals. And so we are going to be doing everything we can to lessen severity before you get to the hospital with monoclonal antibody treatments. And if we need those types of resources in their hospital, we'll be looking to expand our capability inside our health providing clinics to get the treatment that's needed. So again, this holiday season, it's just such a great time to sit back and enjoy those that we cherish the most around us and reflect upon the past year. We also make decisions about how we're going to look forward to next year. We think about what we're thankful for. I know I do. And we have so many things to look forward to. I've always loved that line, the best is yet to come. And I truly believe that for our community. But just recall, how a short time ago, just in exactly a year, we were looking for hope. We didn't have vaccines, we didn't have treatments, and our hope was rewarded. And I've said this over and over, but we never thought hope was a strategy. But we prayed every day, and we got those vaccines, and about a year ago, we started to really deliver them throughout Nueces County. And they've been free this entire time. They've been life-saving this entire time. And we've gone from having coveted them like treasure reserved for only the most vulnerable to really having them completely available for everyone ages 5 and up. I don't have to go over it again, but you know it has been proven the data determines that they are safe, that they are effective, and they save lives. And so now we are fighting back each and every day, and Omicron is no different than Delta, so let's fight back together. There is a new medicine, by the way, that today hit all the news cycles. And I want you to know that there's going to be more details to come, but I need you to know that we've got even more reasons to be hopeful in our new year. The FDA granted emergency use authorization for an antiviral pill. This is a Pfizer product. It's very promising. It would be a new treatment option, and it too would significantly reduce hospitalization and death. Again, all of this was targeted due to this Omicron variant. So we're going to have even more ways in 2022 to fight even harder. And I want to share with you in the last page here of some comments that I made online to our Nueces County employees, because I think that they're the type of comments that I want you all to hear as well. First, let me just remark that I'm so proud and so grateful and thankful to all of the city, county, health district employees. They haven't just kept you safe through this variant. They've helped you stay safe your whole lives if you've lived here. It's just that we didn't know it. We didn't really have an awareness of all the great things they do to keep us safe from communicable diseases to prevention and public messaging. You see, public health has been a part of us this entire time. It's just that now we need them more than ever. And we also need to be grateful and thankful to them more than ever. So take time today, include them in your prayers, think of a happy thought, give them good vibes, as we say on the coast, but really realize how much they've done to protect our community. I feel like they don't get enough credit. I feel like it's so easy to say, what are you doing for us today? But I will tell you that they've been there for us always, and they're always going to be there tomorrow as well. So here are my words. The county continues to provide our way of fighting back from the coronavirus. We're testing, we're contact tracing, we're providing opportunities to have vaccine clinics, we're giving logistics to all those healthcare providers that need them. And I would love for this fight to simply end, but the fight continues. So let's move forward together. Here's what I like to say to my own family. Be brave, be bold, be resolute, be confident. But do these things, have these character traits together. Because together is when we do great things. And I remarked to them that the new year, 2022, is like a new day. It's like a new beginning. And at each new beginning, I think to myself, I don't need to be worried about what I want. I need to be thankful and count my blessings for what I have. So in 2022, I'm thankful for City County Health District together, because together they've gotten us this far. Together, they've immunized over 190,000 people. They've boosted over 20,000 of the 30,000. Together, they pivoted this morning to make sure you and your family had testing next week. From the coast to the country, we're truly blessed. And our strength has always been powered by our people. Those that you knew of, those that you've heard of recently, and those that make your way into your living room through these COVID briefings. And the people here in Health District, they know how to weather a storm, just like you do. And they're just like you. They're neighbor helping neighbor, co-worker helping co-worker. They're always lending a hand and lifting each other up. Knowing that the storm of Omicron will pass us soon, and that we will rise to see the sun shining on a new day, full of opportunity, full of hope, full of possibility, and as I said earlier, with the best yet to come. This new day, I wish for all of you joy, peace, hope, and yes, health. I hope you find this holiday season prosperous and beautiful for you and your family. Wishing you, on behalf of Nueces County, behalf of our City County Health District, a wonderful holiday season and a great new year. Please listen to the great advice that has been given. Stay safe, keep your family safe, stay informed, and love one another. Thank you.
Esta es la última conferencia del año en cuanto al COVID, pero estaremos informando a los residentes a través de nuestros diversos canales de redes sociales de la ciudad y del condado de Nueces. Hoy en día se cree que la variante Omicron representa más del 75% de todas las infecciones por COVID, por lo que la hace sumamente contagioso. Una infección con esta variante es menos probable que tenga que ser hospitalizado, pero aquellos que sí requieren hospitalización tienen el mismo riesgo de enfermedad grave que las cepas anteriores. Omicron se caracteriza por ser más transmisible, pero producir enfermedades menos graves para muchos. Nuestro enfoque es en las hospitalizaciones por COVID y nuestra capacidad disponible. Aquellos que ingresan al hospital tendrán la misma gravedad de enfermedades que las oleadas anteriores. Estamos monitoreando nuestra capacidad en los hospitales y buscaré recursos adicionales según sea necesario. Las vacunas siguen siendo lo mejor que puede hacer. Previenen infecciones y cuando ocurren, las vacunas hacen que los síntomas sean más leves y acortan la duración de la enfermedad. Reducen la necesidad de ir al hospital y previenen la muerte. Le pido que monitoree sus síntomas y en caso de alguna duda, hágase la prueba. La semana que viene tenemos las pruebas de COVID programadas para lunes, martes y miércoles de 9 de la mañana a 2 de la tarde en el antiguo Hospital Memorial. También tenemos algunos tratamientos disponibles, la terapia con anticuerpos monoclonales, que pueden mantenerlo fuera del hospital si lo recibe temprano. El estado de Texas también opera una clínica de infusión móvil. El tratamiento requiere una recomendación médica. Para más información se puede comunicar con el Distrito de Salud Pública al número 826-7200. Le queremos recordar también tomar todas las medidas defensivas básicas, como es lavarse las manos, ponerse un cubrebocas y practicar el distanciamiento social. A lo largo de este año, las vacunas han sido gratuitas y estas vacunas salvan vidas. Han pasado de ser reservadas para los más vulnerables y sus cuidadores a estar ampliamente disponibles para todas las personas de 5 años en adelante. También le quiero informar que existe un nuevo medicamento, una píldora que el día de hoy fue aprobada por la FDA para su uso por emergencia y se cree que su efectividad es del 90%. También estoy muy orgullosa de todos los empleados del Distrito de Salud. Su trabajo nos ha ayudado a mantenernos con salud. Le pido que hoy pida por ellos en sus oraciones y dése cuenta de todo lo que ellos han hecho por nosotros, ya que ellos han estado ahí ayer y estarán ahí por nosotros el día de mañana. Para el año 2022 estoy muy agradecida con el Distrito de Salud. Somos un área realmente bendecida por la gente con la que contamos. Le quiero desear un feliz, saludable y próspero año nuevo. Sobre todo, mucha salud para usted y para su familia.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team to deliver your weekly pandemic report. We have 2 objectives on the modeling team. The first is to address your concerns and questions, and the second is to enable evidence-based decision-making on behalf of our local leaders. We're going to start with a graphic on the daily case count. Now, the case counts are pretty low right now, but what we did this week is compared first infections to reinfections. And one of the reasons why we're doing this is because reinfection rates are going to be higher with Omicron than with Delta, and we're thinking that might be the way that we can first detect the Omicron wave starting. And you can see, let's see if this works for me. There we go. You can see it right over here. Well, the pointer doesn't work too good, but in the lower right, in the graphic, you can see there's an increase in the number of reinfections that we're seeing each day. I'm getting a signal here, but anyway, and we don't see that change in the number of first infections. So this might be the first signal that we're seeing Omicron starting locally. The transmission rate right now is 0.97 overall, which means that in 100 people getting COVID, an additional 97 get COVID. It's essentially a break even, and we're seeing these reinfections rise. In the hospitals, we are seeing a little bit of an upwards trend in the hospitalizations due to COVID-19, and hopefully this goes back down, but we have some indications now that that's not going to be the case. The ICU is distinctly turning upwards right now, the number of people with COVID in the ICU. It's still a low number, but it's moving in the wrong direction at a rapid rate. And that's something that we want to keep our eyes on, because ultimately the number of people in the hospital is going to affect our healthcare system, which then affects health outcomes for everybody, not just for those that are susceptible to COVID-19. Fatalities are moving downwards, and you'll notice again, I'm not projecting here because these projections are based upon Delta, and we're still working on getting a local Omicron model, although we don't have it yet. Now, if you remember last week, we showed this graphic of the United States and what proportion of the variants that have been sequenced were Delta in orange or Omicron in purple, and we were at about 3% locally, and it was 13% in the New York region. This week, this is where we're at. Omicron has taken over. You've heard the numbers, but I think that this graphic shows it very well. You have that difference. Orange, all Delta pretty much, to all Omicron in 1 week. Now from this point forward, we're going to start to see the cases increase rapidly. In other places where Omicron has taken off, the wave was steeper than any previous wave, and that's what we're expecting here. We're going to go from where we are now to all of a sudden there's a lot of cases, and it's going to be even more rapid than we've ever seen before. Now, what is this wave going to look like? This is a projection from the IHME organization at the University of Washington. They're the premier epidemiological modelers in the world, and this is their model for the state of Texas. And if you see way down to the left, those little bumps are the last peaks. The peak from last winter, the alpha peak, alpha variant peak, and then the delta peak from the summer. And the Omicron peak is several-fold taller, projected to be several-fold taller in Texas than these previous peaks. So this is cases, and there's a wide amount of variation in this prediction. But the first thing I want to point out is that in the green line at the lower right, you'll see the projection if 80% of people wear their masks out in public. Masks work. I don't know if you can tell by my voice. I know you can't see me, but I'm wearing my mask to send a message. Previous addresses, I've taken my mask off because nobody's around me, but I want everybody to understand right now it's important for you to wear your mask. They work. And here's some projection data showing that if 80% of us masked, we would substantially lower this Omicron peak to only twice as high as the Delta summer peak versus 4 or 5 times as high. Okay, hospitalizations are the thing that we're really concerned about, and right now the projection is for the Omicron peak hospitalizations to be lower than the Delta peak. Now, what I want to emphasize here is that this is a model for Texas. This is a model made at the University of Washington, where they're not using local data here from the coastal bend. So these predictions aren't as accurate. They haven't proven as accurate as when we're able to make our own projections, which we're working towards. And I will say that their projections have always been low. In all the previous waves that I've been watching this, their projection for hospitalizations has been lower than what we actually experienced. So that being said, this is our best estimate of what we're looking at right now, and now it looks at least a little bit optimistic that we're looking at half the number of people in the hospital at the peak versus previous waves. So what can we do to combat Omicron? And this is something that we can have an effect on. The modeling and the projection shows that if we wear our masks, we can definitely flatten the curve to some degree. So avoid, mask, and vaccinate. That's my message for you. It's real simple. If you can, avoid getting into a situation where you're around a lot of people. 2, if you are in a situation where you're around a lot of people, put on a mask. Masks work. The masks work against flu. They work against COVID. They work against all variants of COVID. And it doesn't matter how long it's been since your last vaccination or your booster, a mask works. Lastly, get vaccinated. It's going to help you have less severe outcomes. Now, here's where things get really confusing, right? Because we're hearing a lot of different things. But I'm going to lay it bare for you. Omicron is just as virulent, it's just as dangerous, it's just as deadly as Delta is. The difference in the outcomes is based upon you, and do you have more protection? If you have been boosted now versus the Delta wave, then you have more protection, and you're going to have a better outcome should you contract COVID. If you've been double vaccinated now versus before in the Delta wave you were single vaccinated, then you're going to have more protection. But if you haven't changed your level of protection, you're actually just as or more susceptible to Omicron because your vaccination fades through time. And that's one of the reasons why you need that booster shot to get your antibody levels up and get your immune system back boosted up. So ultimately, Omicron is more contagious. It is much, much more contagious. The estimates I've seen is 2 to 5 times more, which puts it at more contagious than measles. 2, Omicron replicates in your throat 70 times faster than Delta does. This is one of the reasons why it's so contagious. 3, it's just as virulent as Delta. The difference is, do you have more protection now than you did before during the Delta wave? The way you get that additional protection is getting your booster shot. Especially if you had a Johnson & Johnson vaccine initially, you have less protection with that than you do with an mRNA vaccine. So In review, cases, hospitalizations, and fatalities, they're relatively low right now, but Omicron hits fast, faster than any previous wave that we've seen. We expect it to go up fast. This is a typo. Omicron is in Texas. 3% of cases are not Omicron. 97% of cases are Omicron at this point, so Omicron is here. The impact on hospitals right now, we think it's going to be less. The projection is for it to be less, but this projection we're using has been low in the past. And so I have some reservations about it. I'm working diligently to get you a customized model for the coastal bend so we can have a more accurate and certain projection on hospitalizations. And last of all, avoid mask vax. And if you're symptomatic, self-isolate immediately. If you feel sick, self-isolate, get a test. If you test positive, call your doctor and ask if there's any sort of treatment that you can get now for combating your COVID sickness. It could be monoclonal antibodies, it could be remdesivir, but you want to reach out and make sure, because once you're in the hospital, it's too late, and you won't be eligible for those sorts of treatments anymore. So with that, that should conclude this year's set of pandemic reports. We're going to go to a translation, and then the Associate Public Health Director, Luis WILMOT, will come down and address any questions that you may have. Thank you.
Las infecciones por primera ocasión están disminuyendo en personas mayores de 60 años, pero están aumentando en personas de los 0 a los 19 años, mientras que las reinfecciones aumentan en el grupo de personas mayores a los 20 años. El radio de transmisión es del 0.97, o sea que si 100 personas cuentan con el virus, pueden enfermar a 97 adicionales. El censo de los pacientes hospitalizados por COVID también va en aumento. Son 60 las personas que se encuentran hospitalizadas en el área de la costa con COVID. 18 de ellos se encuentran en unidades de cuidados intensivos. El número de decesos aún no está siendo contabilizado por la variante Omicron. La ola de casos por la variante Omicron ya ha comenzado en los Estados Unidos. Las proyecciones para cuando la variante Omicron llegue a su nivel pico en Texas es para finales de enero o principios de febrero, aunque esas cifras pueden ser menores si las personas utilizan un cubrebocas. Las sugerencias para combatir esta variante: evitando zonas con mucha gente reduce la exposición al virus. El uso de cubrebocas también va a reducir la exposición. La vacunación reduce los síntomas graves. La protección es sustancial contra infecciones graves, pero limitada contra infecciones sin una vacuna de refuerzo. Le pedimos que tome todas sus precauciones sanitarias para evitar contagios, ya que esta cepa es sumamente contagiosa.
Thank you all. Any questions? Thank you all. Happy holidays to everybody. Thank you.
The warmer temperatures are here, and with warmer months come the opening of Corpus Christi's 6 public pools and 3 citywide splash pads: Billwitt Park Splash Pad, Oso Pool, Collier Pool, Lindell Park Splash Pad,